Hold on. Go ahead.
Hello, I'm Dr. Lenore Walker, and today we have a very exciting program for you on our roundtable. As many of you know, we do these roundtables every Thursday at 12 noon Eastern Daylight Savings Time for an hour. We're a group of us, mostly mental health professionals or psychologists, under the auspices of the American Psychological Association's COVID task force. So we're trying to help mental health professionals and all peoples try to deal with the pandemic from a psychological perspective. And so today, Patricia is going to play us a few bars of a song that's going to introduce us, and then I will introduce everybody who's on the Zoom call, and we will get to our wonderful speakers. So go ahead, Patricia. Working woman, yeah. She a working woman, yeah. She a working woman, yeah. She work, yeah. She work, yeah. She a working woman, 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 yeah. She work, yeah. She work, yeah. She a working woman, yeah. She a working woman, yeah. She a working woman, yeah. She a work. Thank you. So if you haven't guessed already, we're going to talk about working women and what's happening to us, those of us who work during the pandemic. So first, let me introduce who we are. We are part of the, as I said, the American Psychological Association's groups dealing with the pandemic. I'm Lenore Walker, and I'm chair of the COVID interpersonal violence group. And with me is our co-chair, Eileen Serlin, who is chair of the International Whole Person Approaches group. And so we're just two groups of psychologists and other mental health professionals who are getting together to try to look at how we can better help people adjust to the new normal, which we hope won't be too normal for too much longer. We've done programs every week on different topics, including getting vaccinations. I urge you to go forward if you haven't and get it when you can, so we can get back to our maybe not old normal, but a better normal. So let me introduce who's on the call with me. I am from Fort Lauderdale, Florida, as you can tell by my background. And with us is Dr. Giselle Gaviria, who is also from Fort Lauderdale, Florida, and Dr. Eleanor Pardis, who is from Israel, but she's visiting with us in the States, and she is in New York right now. We have Mira Jourdan, who you're going to hear about in a few moments, from Michigan. And we have Roxane Gervais, who we're going to hear from as well, from the United Kingdom. And we have Dr. Marilyn, and they're also doctors. I don't want to forget their doctor titles. Dr. Marilyn Safir, and she's here from Haifa, Israel. And Dr. Eileen Serlin, who you met, who is here from San Francisco. Hattie Workboys, I think I pronounced it right, who's here from London. And Dr. Patricia Villavicencio, who's here from Madrid, Spain. Dr. Michaela Mendelson, who's here from Boston, and Brittany, almost Dr. Brittany Geddes, who's finishing up her doctorate, and she's here from Pennsylvania. We've got a dissertation coming up very soon.
And we have Dr. Eric Pepper, who's here from the Bay Area, San Francisco area as well. And you will see that people will be jumping on because we're all busy working, women and men. And so we come on when we can. And some people jump on, some people jump off. So with that introduction, let me turn the program over to Dr. Marilyn Safir, who is kind enough to help us put this program together. So Marilyn, go ahead.
Okay, just a little history. When we formed the task force over a year ago in March, a number of us were concerned about the problem of violence occurring during the lockdowns. And Lenore and Giselle organized a group to deal with interpersonal violence. And we've been active since March of last year. I became concerned with what's happening to women in work. I mean, that's always been a problem, but being a working mother and then locked down in the family. And I turned to Division 35, which is a Society of the Psychology of Women that many of us are also members of, to ask them to arrange some speakers for us. And so we are quite lucky to have with us today Dr. Roxane Gervais, who's an occupational psychologist. She uses evidence-based approaches to promote and support safe and healthy work practices, which are doubly important during this particular period of COVID. She's a chartered psychologist, a chartered scientist, associate fellow of the British Psychological Society, and a registered occupational psychologist from the Healthcare and Professional Council. So we'll be seeing with Roxane. And our second speaker is Mira Jourdan. She's an American Board of Professional Psychology board certified neuropsychologist in practice and a clinical adjunct faculty member at Michigan State University. More important, I guess, she's currently the president of the Society for the Psychology of Sexual Orientation and Gender Diversity of the APA. And we'll turn this over to our first speaker, Roxane.
Thank you, Marilyn. I will share my screen. There we go. So I've got 10 minutes just about to speak about women at work. And it's a topic that I've been working on for quite some time, doing various aspects and looking at women within the workplace and especially across the life cycles of women when they're going through menstruation, when they're going through menopause. So it's all quite focused because we don't stop. Our body functioning doesn't stop just because we're working. So women have all these other issues to deal with when they're in the workplace. So when we're looking at women at work, we have to see it as sort of a continuum because it doesn't stop at any one place. And also when we're considering women's dual role with, home life, work life, you also have to think about it within the domain of the person, the task, and the environment. Because we have to understand how women cope with all these different activities and also and the understanding has to be explored from more than one domain because women just don't function in one particular area. They've got so many different things that are going on within their working lives and within their home lives as well. So how do women work? Now we know they generally tend not to follow a pattern of work. They opt in and out of the workforce at various times in their lives. We know this regardless of country, regardless of sector. And in Europe, it's usually to address childcare, and in the US, where there are fewer options for managing caring responsibilities, they tend to work around those responsibilities. And generally, women work based on how educated they are, that they have a choice in where they work. prime time age women, this tends to function on child rearing. So the child is at the age where he or she can start school, then the woman can opt to go back into the workplace. When the child gets a bit older, they might need some other support. They might have elder care as well to look after. So they have to think about how to manage all these different things within the work environment and also managing the home environment. And again, older women tend to stop work if they've saved enough. And we do know that poverty is a real concern for older women, even though they've been working for quite some time, because usually they don't save enough, the pension is not applicable, or the pension has been reduced for various reasons, or they don't have the social protection that allows them to retire as well. So again, there are very many different factors that influence how, when, and where women work. So what is work? And we might think, I suppose because, all of us on the call and all of us probably listening in, think about white collar work, think about professional work. And unfortunately, a very small percentage of women actually do that type of work. And then when we think about work as well, women undertake 2/3 of unpaid work. And in some, because again, this is an area that does not have as much concrete evidence, and a lot of it is speculative and estimations. But it's estimated that as well, women can do up to 75% of unpaid work, which includes all the caring responsibilities, childcare, elder care, and women also tend to do elder care of their partners as well. So they take on both sets of elder care. They do housework, food, preparing food. And if we look at the cost of that, unpaid care and domestic work is estimated can amount to between 10 and 39% of the GDP. And it's also been estimated that it can contribute more to the economy than manufacturing, construction, and transportation. And the UK is estimated at just over £1 trillion, which is about 56% of the GDP. So this unpaid work, this non-work, it actually has quite a cost and can actually contribute quite a lot to the economy. And it's known that women combine paid work and unpaid work throughout the day and throughout their lives. So you know that if they stop one and then start another, they can do it at the same time. They do it because that's what they have to do. And also an important thing to remember is that 740 million people, women, work within the informal economy. They don't have set jobs, they don't have safe jobs, they don't have jobs with a regular income. That's how they work. And then to deal with all of that, then COVID-19 hit. And, especially the informal economy was one of the first things that was affected. And, it's very hard to get, definitive research right now because of how people have changed their works, how universities have reacted to COVID, how different elements. So the research is still coming in as to what has actually happened because of COVID. But there is a general consensus that COVID has affected women more negatively than men. All the signs today, the informal economy, and we also know that the small retail and service industries, the restaurants, hairdressers, they've all had to close more or less. And that's where most women work. So women have had to step back. And there was a comparison done with the 2008 recession. It said that women bounce back a lot quicker. But with COVID, women are not expected to bounce back any faster than at any other time. So it is actually affecting them. And then we have to consider as well the employment and the pay gender gap. We know that women do not work as much as men, and we know that, again, it has a significant impact on the economy. That if more women work, the economies would be better. But then women can't get work, they can't get safe work, they can't get work that pays enough, they're always going to get paid less than men. And I think it was estimated that because of COVID again, the employment gap and also the gender gap has increased significantly and is not going to close anytime soon. I think a few years ago, I thought the closing gap was about 50, and I think it's increased significantly to get the pay that's similar to men. It's increased significantly since then. And also we know that although there are fewer women who work, they tend to work in certain industries, services, retail, healthcare, education. So 70% of healthcare workforce is made of women. We know there's nurses, midwives, community workers. They also work as cleaners in the laundry, do catering. In the US, women hold 78% of all hospital jobs, 51% of grocery store roles. So again, it's set roles, again, because they can use these roles to actually help with the caring responsibilities as well. It's not, they might not have a choice at times. Sometimes they would have a choice, at times they don't. And again, because women work in these areas, they tend to be more affected by the virus as well, by COVID-19. And if we're going to do a bit, I've only got 10 minutes, so sorry, it's a bit of a rushed presentation. So again, we're going to talk about stress, so stress occurs within any environment. Anxiety, depression, mental health overall, within the work context, because that's what we tend to usually focus on when we look at mental health within work, stress, anxiety, and depression. And, we've all got these understandings about what is stress, how it is, but because of COVID-19, we've got initial research, we've also got anecdotal research that violence has increased against women because of COVID. They're locked in with their partners. Anything can happen if it's a contained, constrained, contained environment. There's no space for people to work together, on their own safely. So violence has occurred. Unemployment, we know that has increased, again, which has affected the financial security, the financial safety, the financial standing of women. And again, it's estimated that women are not going to be employed at the same level as they were now until 2024. And men are expected to be fully employed again by 2022. So again, women are, COVID has not helped their employment status and what they do to actually remain employed and safe and healthy jobs. Again, there's been increases in their caring responsibilities, uncertainty has increased with respect to jobs and lives. Women have also been seen as being at risk of psychiatric disorders, again, the increase of that, again, post-treatment, all these different factors. We know as well are all stresses that can impact on chronic mental health. So I think, women haven't benefited a lot because of the pandemic, unfortunately. And again, the data that are out there, again, they've all been confirming that women are more likely to suffer from mental health due to the pandemic, especially if they're young, they're women, and they have financial concerns. Can they afford to buy anything? Can they afford to pay their bills, pay food? All of those things are stresses that will adversely impact their mental health. Again, this is from some data from the UK. Large enough sample, it was weighted. Again, it shows the same thing that the survey the data from the US showed. Young female, issues with finances. And again, as you see, more women, more likely to be affected than men. And again, working as a key worker has just over a 200% increase of experiencing mental health, as opposed to not being a key worker, as again to just being a person who doesn't work within the health services and those who are older. So again, women are usually the ones who are key workers, as I said initially, nurses, doctors, cleaners, they are the ones who are actually on the front line and they are being affected by this. Now, what is the solution? I didn't do a slide for this, but we know that there are fewer men in leadership positions. And one of the ways, because when we talk about gender mainstreaming, which I've done some research on as well, we know that we say that policy and politics and the organizations have to change their policies and how they work and to get women safer within the environment. And that is, and when you have more women in these positions, in these, more women politicians, more women leading organizations, more women able to change policy, then you can have jobs that are a lot safer, that pay well. You've got the maternity benefits and all these lovely things that we need to function and work and at home. So again, unfortunately, that has not been increasing. So the rate of women going in senior leadership positions has actually stagnated. It has not been increasing. So we have to figure out how best to get women elected to more senior positions and also figure out how to change the work environment so that it's a lot safer and healthier for women. And that's me. I think I've gone over 10 minutes, so thank you.
Roxane, thank you so much for that very interesting and informative and upsetting talk.
I know.
I'm sure there'll be lots of questions and discussion. We'll hold them until after we hear from Mira.
Well, thank you so much. That was really powerful, and I agree, really worrisome information. As just to share a little bit about, my position, I am an Indian American daughter of immigrants to the United States. I work primarily in clinical settings. I also work significantly with the United States Social Security system, and so I'm involved in disability claims and those kinds of things. I've had a really unique opportunity during the pandemic to do telemedicine with the parents of young children in my autism practice. And that's been really fascinating because I've been watching them in their homes with their 1, 2, 3-year-olds. And it's something that really opened my eyes. And I want to share a little bit about that with you as well. So I'm not going to use slides. I hope that's okay. But I want to draw your attention to, I want to share 5 kinds of ideas or concepts that maybe help frame a discussion about some of the unique experiences that minority women have in their experience with work and navigating the pandemic. The first one I want to talk about is the lack of data and visibility. I'm certainly keyed into what is going on here in the United States, but this is a global problem. In the United States, we've had a lot of political challenges to gathering and disseminating data, but it's happening in this really unique way. Probably if I ask everybody on this call how many hours it's been since you looked at a graph of COVID numbers, I could ask that in hours, right? If you're like me, you saw one or more of those graphs during breakfast today. And yet there is a lot of missing information. We have some national data here in the United States, for instance, from the CDC, looking at ethnic breakdowns for things like fatality rates. But when authors have looked in much more detail, particularly in the state of California, which is it's a populous state in the United States, and also demographically a little different than other American states, we see data that's very different. California has published some of the very limited American data on fatalities and breaking them out really carefully by ethnic groups. And they're very, very different data than the CDC has published. And so, for instance, while the CDC does think that there are higher fatality rates for COVID for Black and Hispanic Latinx Americans, the numbers from California are much higher. The CDC, for instance, thinks that there are lower death rates in Asians, but some of the California data really disputes that. And I think that really dovetails with something that Dr. Gervais talked about earlier, having to do with the positioning of women in affected work like healthcare. I think it's also really important to mention that we've made really great progress with women in doctor and nurse practitioner and other advanced roles in healthcare. But as she mentioned, a lot of women work in healthcare in other kinds of facilities as well. In the United States, those roles are things like certified medical assistants, medical technicians, and as well as all of the hospital services, food services, and other kinds of things. These things position women in more direct risk, because women who continued working, often many of them did continue working in situations where they were engaging in direct or close human contact, which put them at higher risk of the pandemic, during the pandemic. And that risk, really potentially doesn't follow traditional economic kinds of lines. And so, I can share my experience as a doctor that I got sick from a patient right at the beginning of the pandemic. And it was so early in the pandemic that masks were not in place yet in the United States. And it was so early in the pandemic that I wasn't even able to access COVID testing. And so a year later, I don't know if I had COVID or not. But those kinds of scenarios, I think are certainly ones to think about with respect to women in the workplace and the risk that women experience. And then adding to what Roxane mentioned, Certainly, we know in the United States and in many other places that the gender pay gap is also an ethnic or racial pay gap. And so we know that those pay gaps differ dramatically. And so, for instance, for Asians, those pay gaps are much smaller than they are for other ethnic groups, but they're very large for some ethnic groups in the United States. And then we have the lack of data that's broken down at a sufficient level of detail to address the concerns of minority women. And so when we think about that, for instance, in the United States, it's very common to omit Asian Americans altogether from ethnic breakouts of statistics. That has some unique challenges. As an Asian American, you know, our countries were involved in developing and producing a lot of the vaccines, but finding data about how the vaccines perform on Asian Americans is really difficult. And then when you add to that the complexity of communicating that to minority women across language and cultural barriers, as well as across the technological barriers, you know, as the general public tries to understand mRNA and vaccine viral vectors and so on, there are some real challenges. And then when that interfaces with a lack of data about Asians broadly, or the lack of data about Asian women or other stratified ethnic data, that becomes a real problem. Just to give you one example, you know, that is from sort of my perspective, I am Asian American, Indian American, and we've known for some time that Indian Americans have a very high cardiovascular risk. That's not really exactly the same as Indians have in India, and it's not really the same as European Americans have in the United States. We don't exactly understand why that is, but when it comes to things like vaccination for COVID, a number of the potential risks are cardiovascular. And so there's a lack of data that's stratified at a sufficient enough level for minorities to make those kinds of decisions. So the second thing I want to talk about, after talking about a lack of data and visibility, and again, those are American examples, but I think that you see a lot of that around the world. And particularly when you look at smaller minority groups, it's very hard to get that kind of data often. The second thing I want to talk about is navigating unwritten rules. And so a lot of us come culturally from high context cultures. India is known for navigating unwritten rules and a lot of complicated procedures that you have to go through in India for everything from getting a phone installed, you know, to getting various kinds of permits or getting your children placed in school. But those unwritten rules are very highly culturally bound. And so, for instance, when immigrants come to the United States, they may come from a place where there are many of these kinds of unwritten rules, but those unwritten rules don't transfer. And so, for instance, a Sudanese American may know a lot about navigating unwritten rules in Sudan, but find that that's a very different experience than navigating them in the United States. And that applies to a whole bunch of things, like navigating work flexibility requirements, navigating work from home or hybrid arrangements. And then it even also applies to things like navigating access to testing for the coronavirus, to accessing the vaccine, oftentimes when there are formal policies, but those formal policies are unclear, and you need to use interpersonal connections to find out even how to get vaccinated or how to get access to care. So the second point I want to make again is that minority women are dealing with navigating unwritten rules, particularly when we think about minority women who have a cross-cultural experience, like immigrants or people working outside of their ancestral country, navigating unwritten rules in a different culture. The third thing I want to talk about is the idea of being half acculturated. I was born in the United States and raised here, and I generally consider myself highly acculturated as an American. But on the other hand, I did grow up in an Indian household here in the United States, and I did also get heavily exposed to Indian traditional values as part of my own upbringing. And I think about a lot of our immigrant community in the United States, and individuals may be acculturated at varying levels, but they're caught between cultural values from their home country and cultural values that they're experiencing in the country that they live and work in. And that applies to things like multiple life roles. for people who come from more traditional cultures, they may feel higher levels of pressure to carry out home roles at a high level of expectation. I can relate personally that early during the pandemic, when I was doing more work from home, I also felt a really high pressure because I was home to be cooking fresh meals for my family and engage in more meal planning and those kinds of things, even though I was also working around the clock in a lot of ways in my own practice. Just to give another example from my cultural group, we were talking before this started about feminism, and I actually just recently got married, and I decided to change my last name, and that's a talk for another time. But there's some evidence, for instance, among Indian Americans that more recent Indian American women immigrants are actually have a lower workforce participation than women from my parents' generation. And that means also that they may be feeling especially high pressures to perform in household kinds of ways or according to expectations, including expectations that they bring from their home country. The fourth point I want to talk about briefly is separation from families. We're all dealing, I think, with that. But when we think about immigrant communities in particular, and minority communities that are more geographically spread, in my case, my parents live on the other side of the United States, and all of my extended family in North America is at least, I think the closest person is probably 200 or 300 miles away, and most of them are more than 1,000 miles away. And then, of course, I have family in Europe and various parts of Asia, including India. And there's an article in the New York Times about this from Dr. Pui-Ying Tam. It was published a couple of days ago, and it's something I encourage you to check out. And she talks about her experience with having a family separated across the globe, and very ranging from things like who can get vaccinated to who is not able to access the vaccine, to worrying about family that are on the other side of the planet, paying attention to the COVID situation in her home country while also paying attention where she lives, and dealing with all of those kinds of things. For some people, layered on top of that are also concerns like visa fears. There are people on this call who are visiting their family, and I'm getting closer to visiting my own parents. And I will send you that article link. I'm getting closer to visiting my own parents, and they live in another part of the United States, but that's not so hard. But thinking about minority women and managing the risks and realities surrounding visiting their parents on another continent, and whether that's safe to do, whether they'll be able to return, whether their work or career will be disrupted as a result. And then the last thing I want to mention is the xenophobia. And so xenophobia and racism are problems in general, and they also have unique factors that occur during COVID-19, particularly thinking of some of the anti-Chinese and anti-East Asian hate crimes and rhetoric. A number of politicians here in the United States have contributed to that, and that is happening internationally as well. So thinking about navigating that additional stressor as they are navigating their family and their job and working from home, and their family who's at risk on the other side of the planet, and all of these kinds of things. So these are just some thought points about some of the unique experiences of minority working women during this pandemic. And so those are some ideas that I want to throw out, and I'm just really looking forward to this conversation. Thank you.
Thank you. Very, very interesting and exciting. Marilyn, do you want to take over?
I'm getting, okay, I couldn't get unmuted. I think that both of these talks raise issues that we haven't really discussed. Does anybody in this particular group want to say something or ask a question? And are we getting any questions from the people watching in Facebook? Eileen.
Yes, I want to thank you. And it's, yes, upsetting or depressing. I don't know which, hearing this. I wanted to ask Roxane, you know what occurred to me? There was a bit sort of it is about politics, I must say, but I was thinking about the controversy when it came out about lean in harder. I think it was Sandberg wrote that, and that women should just lean in harder. And you know, so what do we do about all the external factors that make it so difficult if politics is not changing?
Well, I think if we leaned in anymore, we'd be toppled over. I think women do.
I like that.
I think women are resilient. We adapt,
Mm.
we change, we focus on what needs to be. We just get on and do it. That's the issue. And we have to be supported at the macro level. And some of that, and the legislation is there. Governments keep putting, limits on how many women should be on boards, and they're not being met. So we have to think, well, why are they being met, and why women, keep not getting appreciated for what they can do. And I think, but the thing is, I think now there are quite a lot of global leaders who are women. So we have to see maybe in 5 years' time if we can actually see a shift as to how women are treated within the workplace, because we still know, especially when you look at occupational safety and health and safe practices, personal protective equipment and respiratory protective equipment for women is based on the research that's been done on men. That's never going to work. And even now, women can't get PPE that fits them. I mean, when I got like safety boots and a high-vis jacket, it was too big. The boots weren't comfortable. They were too heavy. I'm thinking, well, what am I supposed to do with this? They weren't functional. So, we have to look at every single aspect of how do we make sure that women remain safe within the work environment. And one of the pictures that I had on one of the slides, you saw women in an East Asian country working in construction. If you look at their feet, they were all wearing slippers. And that's the reality of it. They don't wear boots. They don't wear steel-tip boots, which you should wear regardless of, especially if you're working outside on a construction site. They don't have the PPE. They probably don't have the knowledge. That's what they need to do. But they're wearing footwear that's comfortable for them, that's suitable, and that probably they can afford. So there's a lot of education to go on. There's a lot of policy decisions that need to continue to be made. You need to make sure that organizations do know they have to keep changing. They have to be welcoming. The culture needs to change within organizations. So it's not a quick fix, unfortunately.
And Roxane, when you mentioned the whole thing about the boots, and it made me think of NASA not having the outfit for one of the women's to travel, NASA. And then it reminds me also about the movie Hidden Figures, and we've always been there, and especially minority women have been there through the trenches and helping out, and yet it's only now that we're starting to realize it, and yet we still can't figure out finding the proper equipment for women to work in NASA.
I think it's very interesting that here in Fort Lauderdale and Miami, which is very much dependent upon the tourist trade, and the tourists still keep coming. The restaurant industry cannot keep enough people to staff it. And they're complaining that because women are getting the stimulus checks, that they're not going back to work. And my thought was, well, maybe if you made the working conditions more conducive to women, they wouldn't mind going back to work, because most of us are trained to want to be productive in some way. But I also thought about the importance of looking at how do we learn to value all of the work that women do that's unpaid labor. How can we put a value on that? The stimulus checks sound like it's a gift to people, and yet it's really money to keep you alive and surviving, and your family to survive. And so the way we present these kinds of topics, I think, need a change in how we address them.
I'd like to reinforce what Lenore is saying, because I think we've seen, actually worldwide, we certainly see it in Israel, people that, not just women, but people working in industries like food and service, where the pay is low, especially when they have to rely on tips to add to their salary. They're not going back to work because the money that they're getting from the government payments is better than the salary than they would be getting if they go back. I wanted to make another comment. Roxane mentioned that women leaders worldwide have increased. I saw a review about a week or two ago that showed that the countries that had women prime ministers and presidents were dealing much more effectively with the COVID situation than the United States and Great Britain and some of the other we have some of the other countries worldwide.
I just
Let's
want
go
to
back.
address the issue of the unpaid labor that Lenore mentioned and that was mentioned in the presentations, because I really feel like that's been one of the things that has completely exacerbated some of the inequities that existed before. That with the pandemic, women have disproportionately had to pick up the burden of childcare, of elder care, and so I think even for women in more professional roles, and in my private practice, those are the women that I tend to see, it has been a real struggle to stay in the workforce. Like just staying in the workforce has been an accomplishment, where women have been trying to balance the, kind of trying to keep their kids in school and keep on top of their kids' mental health needs, which we've been talking about as well, and take care of elderly parents or parents-in-law and sick, relatives who may be sick. That even just staying in the workforce for women in a position of privilege, I think in this country and relative certainly to most women in the world, has been really an accomplishment.
It's so true, Michaela, when you think about all of the women's groups of psychologists that I'm involved with, so many of us, despite our privilege, are working longer hours at our jobs in front of screens, mostly because most people have not gone back to in-person work. And we're filling our hours with work because the demand is there, and the demand is there for our family work and our responsibilities, the unpaid labor that keeps our homes going and our families going. And so for many of us, I love, Roxane, your comment that if we bent any longer, we'd be on the floor, because I think that's what's happening to so many of us. And I worry about burnout. At what point are we can we keep this up without having some relief?
I also want to, can I add to that? I really want to follow on, I think our research also shows that there's much higher susceptibility to burnout and compassion fatigue for women. However, at the same time, there's quite a lot of testimony to resilience that you mentioned earlier. And I think we should be looking at the opportunities for women in this pandemic, or if you could call about the post-COVID world, to envision a world in which maybe there will be more opportunities for working from home that weren't open earlier. I think we once did research on age, culture, and gender. So we found there that the power, we looked at the power, and for aging women, and I feel very privileged because the burden with the young mothers when they have all the kids at home is completely different situation than for women my age. And I know that my mother works, and she actually, her work through Zoom it makes things easier for her because now everyone is at home. She's not the only one who finds it difficult to leave home. So there are opportunities there in working through Zoom. There are difficulties at the same time, but she's a CEO of an organization and she can do her work from home. For me, I can travel around and work and teach from university while I'm in the States and I'm teaching in Israel, which is, I wouldn't have been able to leave in the middle of the semester if not for COVID. And I can think there are many other opportunities that we need to look, and really I feel privileged, but I think that this is such an amazing perspective that you bring, Marilyn and Mira and Roxane, bringing in also the sexual orientation and the importance of diversity and space for diversity.
Mira wanted to add something, I think, yeah.
Oh, sorry. Yeah, I very much appreciate that. Here, at least here in the United States, the workforce participation rates are the highest for women, for women who have children who are, the workforce rates are the highest for those with kids from about 6 to 17. And that's a group that's experienced the really dramatic changes with homeschooling and the expectation to be doing a full-time job from home while also child rearing from home and being a tutor. And I think that has been really challenging. But then I think you're absolutely right that it also is a source of resilience. And I shared in the chat a Planet Money program that came on yesterday on NPR here, and it talked about there's this old movie called 9 to 5, and I think Dolly Parton is in it, and the women take over the workforce and fire all the men, and but they make all of these changes, and we can ask the questions about how does work really be flexible, so I'm not expected to be a 24-hour parent and a 24-hour remote worker and a 24-hour spouse all at the same time.
I have a different kind of I'm just thinking here about this combination we're hearing on the screen about the sort of the depressing side of things and the possibility for resilience and what women can do. And I'm sort of wondering where that fits into on the one hand, the growing Me Too movement, which is very exciting. On the other hand, this increasing, maybe it's just visibility of sexual violence we're seeing. And among the politicians, we have scandals going on now with certain politicians in the United States. And I'm wondering if that's increasing as well, or it's just more visible, and what we make of these two kind of opposite trends, really, that we're seeing.
I think Eleanor was a bit overly optimistic in what she's saying. I think that the resilience and the ability to expand is something that's related to social class, and that's certainly not the situation for women in the lower middle and lower classes. And I think there we're seeing the situation getting worse, and I don't see that the chances are getting better. In fact, Mira, I think, gave data that shows there's a real slide back, and the data with men being fully employed by 2022 and women 2024, that immediately shows, I think, a serious problem. So we have to keep in mind that the women who haven't succeeded in getting an education that allows them to getting a more professional job, usually professional jobs come with some kind of work agreement with pay and so forth. And I've seen happen now, women working in lower paid jobs because there is such pressure. Many of them have been forced to reduce their salary, not to increase it. So I think these are things that are going in different directions. And right now, my concern is of the people that we've been hearing about from Roxane and Mira. And certainly But when I've been reading the United States, the middle class has not benefited from the various tax reforms that were made in the last 4 years, and the lower middle and lower classes have actually gone further backwards. So I'm very concerned about the situation.
And Marilyn, what I see in my practice to support that is also lower middle class women are dealing with an epidemic of drug abuse. We're seeing a number of women who are dealing with not only everything with work and home, but children who are getting addicted and dying of overdoses. And I don't think that can be left out of this equation.
Absolutely.
I think these are so
Drug
important,
epidemic.
but I want to add in, from a policy perspective, I see some changes. I don't think it's filtered down yet. But for example, I see some real change in terms of dealing with diversity and dealing with the inequities in healthcare that have been exposed during COVID. Not that it wasn't there. And like you said, Eileen, not that sexual abuse and sexual harassment has not been there. I certainly, from my practice, it's been there and at much higher rates than we're even looking at and exposing now. But again, nobody's really cared about it. It's been a lower priority. And if you push things up on a policy level at maybe it'll make it a higher priority, but not without the absolute pressure that we have to keep on politicians, whether they're men or women and whatever class they come from. If you look, I think it was in the New York Times, they had a graph of the class and racial diversity in the United States government. And, despite the fact that women are out there in the workforce and are in many of the legislatures, if you looked at it in total, in Congress, the most dysfunctional place right now, I think, in our government, it's almost 75% white males over the age of 65. That tells you the story, really, of why women are having such a struggle. The song that Patricia played she only played the refrain, which was the working woman refrain, which was a great catchy tune. But if you listen to the words, which I did because we thought about playing the whole thing as a background, it's a man who's saying he wants his woman to go out and work so he doesn't have to pay, she can pay the bills. She wants to be so independent, and there are still cultural values that keep women from going full blown into careers that they're happy with. So those are things we need to change at the very youngest level.
I'm smiling, Lenore, thinking about, you remember that Greek play? I think it's Lysistrata, about how all the women organized and just withheld sex. Can you imagine all the forums? As policy changes, let's find the levers of power here.
Patricia, you wanted to say something? You have your hand raised?
Congratulations to both of you. And Marilyn, thank you so much for bringing these wonderful and excellent presenters. And I think, well, I live in Spain and I'm Peruvian, but when I read minorities, which is a word that is used in United States, right? And maybe also in UK. Something that comes to my mind is that we all women, I feel a minority in any case. I'm not in the lower social class. I'm a PhD postdoc and so on and so on. And we women still struggle for equality, and feminism has turned out to be very radical right now. And here in Spain, that people complain about it. And I say, well, there must be people fighting for our rights, even though we are black, yellow, green, blue, right? And any kind of sexual orientation. Plus, I would love to add something before COVID. I work in a public hospital and with teenagers. And recently, I've been having, before COVID and during COVID, lots of kids that their mothers have come to Spain to work and in domestic, how you call work. Uh, and so usually they have uh, scarce little location, and their kids come or have been born here. And that what's something you mentioned, Mira, that people kids born from other their parents from other cultures, they learn from their parents that still they don't have that culture 100% in their minds. So that's a lot of confrontation. It sometimes gives lots of confrontations. And being me and an immigrant, long-time immigrant, when I have kids come into my office, their parents from Latin America or other countries, I have to point out to their parents that their kids don't have their cultural values, and they expect that, and the kids don't know about their parents' values. So that's one thing that we're struggling as women. And I feel in anywhere where women, and we are minorities in any place, even though any kind of religion, class, race, and so on, sexual orientation. Thank you so much for your presentation.
I think it's so interesting. I think of my own children who, my own daughter who was trained, she was educated, she has a doctorate in psychology, and she has chosen to be a stay-at-home mom, raising her 3 children. You know, and we've had discussions about how she always felt like she wanted me to be home more. And of course, in my day and age, that was always the topic. Women always felt guilty about not being home more with our children. And obviously it was picked up. So I don't know about the next generation.
Speaking of that, Lenore, and if I may, and with Mira, Mira, not to be too personal, but this question about changing one's last name. I'm seeing our daughter-in-law and a number of other younger women of maybe your generation who are changing their names and going back to more traditional kind of wedding ceremonies and so forth. It's sort of interesting to me because these are the children of rebellious people of my generation who, you know, want diamond rings and changing their names and all of that again. So maybe just a comment on what you're observing from your.
Yeah, I think that maybe before we started, somebody had commented that one of the great things is that we have the option, you know, that women didn't have in prior generations. And then I think, you know, so as I think about the parents I work with, they go through the experience of buying the really fancy diapers for their first child, and they realize that some of the things that they thought would make them feel more equal or experience more equality are not the most important things for them. And you know, the fight for feminism moves to a different kind of arena. And then I think also we're all caught between trying to integrate our cultural values and background and heritage with our vision of what the future could look like. And so, you know, I think that that's a constructive and a really beautiful process, but it's also unpredictable. And you know, I think we're all figuring that out together, and also in our unique and separate ways.
Well, just in terms of the culture, I work a lot in China. And the women there, or I guess of your generation, are really caught between parents who really want traditional lives for them, And they're seeing now all kinds of modern options that they want for themselves. And they're really asking, what does it mean to be a woman? You know, does it mean I work in the fields along with the men like it did my parents' generation, or before that, you know, do I bind my feet and stay home? And what do I do now? And there's a lot of, you know, I would say depression and anxiety associated with these choices. It's, yes, on the one hand, all kinds of new options. On the other hand, it's very frightening with no real roadmaps or precedents for them.
True. Brittany, you have your hand up.
Yeah, so as somebody from the younger generation that's coming up, I just wanted to comment because I related so much to what some of you said. And I think as I think about how I want to plan my career, there's so many aspirations that I have for my career, but I also, having a family is something that's really important to me. And I often do have anxiety, like Dr. Sherlin said, of thinking about like, how can I have it all? And like, I have this feminist value of like, women should be able to have the family life and have the career life. Why do we have to give things up? Why do we have to choose? But I often wonder, is there going to be the structural things in place for me to be able to do that if that is what I want? And I think how I think about feminism is if a woman wants to be a stay-at-home mom and that's her choice, then like that's feminism too. But I think where it doesn't become feminism is when women are forced to do that and it's not a choice, where they have to do it because of a lot of the things that were brought up in the presentation. So I just like, it really spoke to me because I'm also trying, and I even like have conversations with my supervisor in clinical supervision of like, how is my identity as a woman shaping my career, and how can I have both of these things, and how can I have jobs in a career setting in psychology where I feel like I'm making a difference in the field, but I also can have an adequate work-life balance, and I can be there for my kids when they need me and things like that. So there's no easy answer, but I really appreciated the conversation about how difficult it is, at least in our country, for women to have both, but how at least my generation really seems to be striving to want that.
I think that's it. I wanted to mention something that Roxane said. I think that politically, if you have full day education, if you have childcare, government-sponsored childcare, where you can bring your child in and your child can be taken care of, so the woman to work. This makes the option easier. And then those of us who've had children that have been jealous of mothers that stayed at home and baked for them or something. Although
Roxane, I'm going to let you have the last word before we're going to have to end because we're at the end of our time.
Yeah, thank you. Yeah, I was going to say what Marilyn said. I think we need to put the structures in place, as Brittany also. We need to have childcare in place, elder care in place, maternity leave, because women around the globe don't have consistent maternity leave, and they choose not to work, they choose not to step away to look after kids because they're afraid of losing their jobs, because when they lose their jobs, then you've got the feminization of poverty. So it's a cycle that we have to break, because we need to get women in the workforce. We need to improve the economies. We can't do it only on the labor of men. Sorry, Eric.
Eric, you have been wonderful. I have to compliment Eric, because usually when you have one man on a conversation like this with all these women, he has to step in. And Eric, I want to give you a chance before we go, if you have anything you want to add.
You're muted.
You're muted.
You're muted.
You're muted, Eric.
You're muted.
Well, I totally agree with the comments that, I think women carry the burden in our culture and they have multiple jobs, and men are easy. I mean, not easy, but basically when you have children, in most cases, at least in most cultures, it's the women who carry that burden implicitly. And it's not even what you do. I would always call it, when I work with clients, there's who carries the responsibility for the organizational part. Who is the one, even if you have a partner who is very great and is very helpful, but if you are the one who has to organize and say, oh, we need to get eggs, or can you call so-and-so for daycare or whatever? It's that burden of responsibility, which I think is even much more so, because that's an omnipresent vigilance you have to carry, which many men don't have to do. And I think that is an implicit burden outside, and that we usually don't speak of it that way. So that's my own, but I do notice, I was interesting in about from the roles that about someone spoke about the younger women. At least my colleagues in the Netherlands have said, where I teach physical therapists, that their mothers, many of them had delayed birth onset. I mean, they waited till they were much older. And then many of them had some fertility problems.
Mhm.
Their daughters, many of them are having early births. If they're gonna have kids, they do it much earlier, which as a biologist, I can only support because of the
Nothing like the pendulum switching back and forth. We're going to have to end. This has been another wonderful, wonderful discussion. Thank you so much, Mira and Roxane. Thank you, Marilyn, for putting this together. And we'll see you all next week, same time, same place. And Eileen will have a big announcement on the what we're going to be doing at that time.
A few exciting options on the table. So we'll see
Have
which
a
ones come through.
very safe week, and see you then.
Please don't forget to follow us on our Facebook working groups that we have, COVID IPV, and also international whole person approach groups on Instagram and on Facebook. Follow us, comment, and question. Thank you all. Bye-bye.